Thank you very much and welcome back to the show now. We're joined this morning by Sharon Gilmartin from New Therapy, and what we're looking at this morning is treatment for acne and also for wrinkles. We want to get rid of those wrinkles, but basically for acne scars. Good morning to you, Sharon.
Morning, Alan.
Tell us a little about the machine and how this works.
Okay, this is the Pearl laser, and what it does is it smooths out lines and wrinkles and also dramatically reduces acne pock marks. How it actually works is it's a laser peel essentially, and it peels the top layer of skin and thus smooths out
now
the
this
skin.
is Ginta, and we have a whole selection of pictures of Ginta before and after. Like basically this is before she went in, had the Pearl laser. She obviously was very badly affected by acne.
A year ago Ginta came to us and she had about 80% of her skin covered in complete active acne. So we cleared that with our skincare range, or his clinical skincare range, and then underneath the active acne she was left with some acne scarring, which is the acne pock marks.
So it's the little pock marks that you see that people have, even like when they get older, if they had the scarring when they were younger.
That's right, exactly. We did just one single Pearl laser treatment and she had about 90% smoothing of her skin, as you can see there. Even Ginta herself will tell you that she feels her skin feels an awful lot smoother.
Right, okay. So tell us about the machine then and how it works. And how does it work on wrinkles then? Because I know there'll be a lot of people out there going, okay, it works on wrinkles, how do I get rid of my wrinkles?
It's fantastic for wrinkles. How it does, the wavelength from the Pearl laser is actually attracted to water in the skin, and it vaporizes the water and thus peels the top layer of skin. It then thermally heats the underlying layers, which then stimulates the collagen and plumps up those indentations. So that's how it smooths out.
Right, so it will smooth out here. Give us an L blast. Give us an L blast there.
Well, we normally apply a numbing cream for half an hour.
I know, I'm only joking.
We put that on for half an hour before we do the treatment. It
okay, so why do you need to numb the skin?
Well, all lasers have an element of discomfort, so there is an element of discomfort to this. So it just improves the comfort level.
Is it like a heat?
It's heat. It feels hot, and it feels almost like a little pinch, really, on the skin. That's how it feels.
Okay.
You know.
But let's see it working then.
Okay.
So you've applied the cream.
Goggles for
I have to put on the goggles, do I?
Yep.
Okay.
And we'll just slip these goggles on.
My Dolce & Gabbana look here this morning. There we go. Very fine.
We'll arm it up. So essentially.
So basically, when you have somebody in, you put the numbing cream on, you put the goggles.
Leave it for half an hour, then remove it, and then we're ready to fire the laser. Then now, the more hydrated the skin is, the actual more effective the skin is.
So would you tell people to be drinking lots of water and stuff beforehand?
Well, to be honest with you, it's actually better if they use a hydrating serum. We recommend a very hydrating serum like the polyvitamin or the HydroCool serum. There's two hydrating serums that contain sodium hyaluronate.
Should you be putting this on your skin all the time?
Ideally, yes. But maybe a month, two to 4 weeks before the treatment, we would get the client to use the product, and it introduces super hydration. So therefore, the laser is attracted to moisture in the skin, and you have far better results.
Okay.
So we'll just try a little shot here of it now. Here we go, Ginta.
Oh.
That's really it. And then we just continue on, and it's just a series of patterns of pulses, and it just ablates
Is that nearly like burning away the top layer of the skin?
It's vaporizing the top layer, because the moisture in the skin is just vaporized.
Right, okay.
When we complete the whole skin, the whole area on the skin, we actually apply a thin layer of Vaseline on the skin just to keep it moist. We recommend the client to use Vaseline for 3 to 4 days until the skin peels. The skin will slot away after about 3 days, and
will it just start peeling off?
It'll start peeling away.
So you'd obviously have to keep very high sun factor on then, and stay away from the sun and things.
We recommend a factor 25. This is a treatment sunscreen, and it also helps to minimise the redness, but actually it's an organic broad spectrum block. So we'd get the clients to use that on day 5 post the treatment, because for the first 4 days they use a thin layer of Vaseline, and that helps to keep the skin moist and obviously occludes the skin.
And so when you're doing this, would the skin become very red after the session?
Yeah, they are quite red. So what we ask the client to do is on day 5 post the treatment, we give them a Pro Heal serum.
Just want to see if we're getting that. Can we get a close-up of that as you're doing it, just to sort of see what we're doing?
This Pro Heal serum helps to minimise the redness. It's super anti-inflammatory. So on day 5 after the treatment, we give them the Pro Heal, and it calms the redness. It's also naturally antibiotic, and also it helps with collagen formation. Now, how collagen is stimulated is from the heat.
Yeah.
But we recommend the client to use pure vitamin C. If the client uses pure vitamin C, Vitamin C must be present in the skin for us to actually produce collagen.
Right.
So we give the client a super serum which has 15% pure vitamin C, and unfortunately our skin can't store vitamin C, and orally ingested vitamin C is preferentially absorbed by our organs.
Right.
So if the client topically applies vitamin C, it actually helps with the collagen formation. So for both,
you're saying, like, if people have bad acne, but if they get the treatment for the acne and it comes down to the pock marks, then that with this treatment there's a 90% clearance rate
after one treatment. Now Gintha's only had one treatment about 6 months ago. The results continue to improve for 6 months after the treatment. Now Gintha's ready for her second treatment today. So we want to completely get 100% smoothness on her skin. And we can achieve that with a second treatment.
Okay, how much does it cost?
Now, Pearl Laser is €1,000 for one single treatment, but we have a very special offer at the moment. It's at half price. It's only €500 for one single treatment. It only takes a half an hour.
But €500, I mean, if it is a thing, because it must be a sheer confidence boost alone.
Absolutely.
If you to get that, get that from your skin.
Gintha actually changed her jobs. She was in a job where because of her confidence levels, from once we cleared her acne, she changed her jobs, and she actually stopped going out. Isn't that right, Gintha? Stopped going out.
But started sort of getting back into the community, back into going out, and just because the confidence grew.
The acne really affected her whole life. So I mean, since she had the whole treatment between the treatment for the active acne and the scarring, her whole life has turned around altogether.
Okay, it's a new therapy, and as we said, half price. It was 1,000, now 500. So if you want that,
and it's brand new technology, very new. We're the only beauty salon in Ireland with the Pearl Laser at the moment.
We've given your details on the screen, and as always, Sharon, thank you very much for that, and thank you, Gintha. Thank you very much. Now we're going to take a quick break. Lots more still to come. We'll see you in a few minutes.